Good morning. My name is Vanessa Arline, and I'm the co-chair of the CAUTI Prevention Collaborative Team with Infection Control here at Baylor St. Luke's. Today I will demonstrate perineal and indwelling urinary catheter care in a seamless fashion. First, so you'll see how easy it is, and also so we will discuss in a way that you'll know how important it is to consistently perform this process to prevent patients from developing a CAUTI. First, I have a supply list, which includes clean gloves, our CHG swabs, alcohol swabs, disposable towels, and then I also have a basin full of those towels, and I'll give a little bit of discussion on why I'm using this setup. So, I'll first don my gloves, and this basin is one that we use in situations where the patient's in a semi-private room or where the sink is really too far away from the patient for you to perform this process efficiently. The basin is in your supply closet. It costs about 39 cents. So every time you perform this process, you must use a new basin. We have found by evidence that to try to reuse the basin transfers microorganisms back onto your patient. So please dispose of it. All that we're doing is very detailed in preventing a catheter-associated UTI because we also found out that the cost of treatment, which includes patient stay, cost of medications, cost of staff to provide care, averages around $60,000. Insurance will not pay for that. Your unit will. So please make sure that you perform this process consistently and that you document every time it's performed. Okay, so let's get started. My basin would be filled with warm water and then a stack of about 12 to 14 towels we have found will sufficiently complete the process. So once I've explained the procedure to my patient, I'll only expose the pelvic area, and I'm using my infection control approved soap to cleanse the patient and never CHG. Even though we're keeping our patients clean, there are bacteria that live in the pelvic area that protect the patient. CHG in that area will kill those bacteria that are protected. So, plain soap and water. First, I'm going to release the catheter from my securement device. There are only two that are approved, either the Statlock or the elastic strap, which is called a Dale catheter holder. That one is most beneficial for elderly patients who have tender, thin skin. Please don't use a Statlock on their skin because you could cause skin tears. Okay, so my patient's also on a dry incontinence pad, and I can get started. My first towel, I'm going to wring the water out, and I'll add my soap, which is concentrated. And I'll add enough of this soap so that I can make a nice bit of lather. I'm cleaning from the outer areas, primarily the thighs, toward the inner, and then finally the catheter in one direction. That way I'm not recontaminating any cleaned area. So I start with the thigh and wash the thigh very well so that I see that this patient is visibly clean. I'm gonna make sure I clean any crevices, the groin, and this is a pretty sturdy towel. So if I need to wash a little more and there is a clean area on the towel, I can do that. Then this towel will be discarded. If there was not a clean area, I would just simply get another towel and add more soap to make sure my patient's really clean. So once I wash, I rinse. And we wash and rinse each area before proceeding to the next area. All right, trash. So my next location is the other side. Wash it really well. Make sure that I'm getting in the groin and discard. And now I'm going to rinse. Next, I will go to the labia majora that's nearest to me, and using a twisting motion, making sure that I can see that I'm visibly cleaning from top to bottom and not going back and forth. I'll work from a cleaner area to the dirtier area. And now I'm going to rinse. Make sure all the soap is off that patient. As you're cleaning the labia majora, you can also include the minora unless it is grossly soiled. Then you'll want to use additional towels for washing and rinsing. Now I will go to the opposite side, soaping from the top to the bottom. I am not including the catheter yet in this process. The catheter is done separately. And now I will rinse. At this point, I have concluded perineal care. I'm going to remove my gloves and now use sanitizer and apply a new pair of gloves. The reason for that is sometimes patients have wounds and extra soiling on the body, and I don't want any of that residue on my gloves as I begin to clean the catheter. So now I'm applying my soap, real soapy, to the catheter. It is important to try to gently enter as far into the indwelling catheter insertion site as you can without causing discomfort for the patient. So I want to go as far into the area of the urethral meatus and just begin to gently remove any soiling that I see, or just to get as clean as I can using a twisting motion, and then avoiding pulling on the catheter. That's very uncomfortable. So as I'm moving down, then I can stabilize that catheter and continue to vigorously clean this catheter using that twisting motion, only going in one direction, down toward the red seal. It's important to note this seal should always remain intact. The CDC has identified this area as a bacterial entry point. So if you have a patient that needs irrigation that would lead to the decision to remove this seal, this patient really should be considered for a three-way catheter so that this seal is maintained and you have a dedicated port for irrigation. And now my next step is to rinse. Again, going as far as I can gently and using my twisting motion, getting all the soap off the catheter. All right. Now, here at St. Luke's, we have received permission from our National Infection Control Office to use CHG. This is an extra protection on the catheter surface itself. And what it does is, through evidence, provides up to 48 hours of additional protection of any bacteria that may come from the patient's legs or drainage from entering into the urethral meatus. However, this product has 3% CHG and 70% alcohol. So we want to not cause our patient any discomfort by touching the sensitive vulvar tissue with this product. So use 2 fingers just to protect the skin, and you can wrap this cloth around the catheter and simply paint the catheter. Because of the alcohol, it will dry in seconds. And you've provided an extra level of protection to your patient. Next, because I have a shiny new catheter, I can clean my stat lock with alcohol, and alcohol is sufficient on a non-skin surface to provide cleaning. It also dries quickly, and I will apply my catheter to my stat lock, making sure the pin is between the balloon port and the catheter, and close it. That concludes perineal care and catheter care. So my next considerations are to make sure that my drainage system follows the recommendations of BARD, our catheter manufacturer. The catheter should be anchored at a hook near the foot of the bed. And there also should be a small loop which allows fluids in this vacuum system to flow well. This doesn't cooperate very well. So one recommendation is to just take your tubing and manipulate it in such a way that it'll cooperate with you. So once I've got a flat horizontal bed loop, I can apply my clip to hold it in place, and then I will hook my catheter bag into the hook underneath the bed. And I should be able to observe dripping of urine into my urinometer. So next, we'll demonstrate a few considerations on patients who have a catheter but are male. All right, now my male patient has a few extra areas that require cleaning. We started with the female on the near side, and I can do the same thing with the male patient. So I will begin to clean from the top down alongside the shaft, all the way from clean to dirty. And I'll discard that towel. Then I will rinse. On the other side, I will provide my soapy and clean that side. And I will rinse. The next step for the male, however, is with my soapy towel, I'm going to clean first the glands, starting at the insertion site, using a circular motion, and clean down the shaft toward the body. And then I'm going to rinse my patient in the same fashion. If my patient is not circumcised, I will retract the foreskin, clean the shaft in the same manner very well with soap, and then rinse, and then be careful to reduce the foreskin. Finally, and most importantly, I will clean the area of the scrotum, starting with the upper side of the scrotum and then lifting the scrotum and making sure I gently clean underneath. This is a very important step because patients who have a catheter and maybe run fevers tend to have extra secretions and perspire greatly in this area. Many times the patient will have an excoriated area. So you want to be able to discover that by cleaning well to treat it. So be sure you clean the upper part all around and underneath the scrotum. And of course, please gently rinse and make sure that you're leaving the area dry. Then, with the male, I would proceed with the next step of removing my gloves and continuing with cleansing the catheter, rinsing it, and applying the CHG. Other considerations for perineal and catheter care are, please remember, whenever your patient is incontinent of stool, this entire process must be performed. Keep in mind that if a patient gets a CAUTI, the specific organisms are isolated. And we would not want our patient, just because the patient is incontinent of stool, to end up with a CAUTI, which is very likely if there's insufficient cleaning. Secondly, please make sure that every time catheter care is performed, it is documented. That is also tracked. So we want to make sure that in providing care, we're documenting all the care that we do to get credit for that, and most of all, to protect our patients. Thank you for watching.